My name is Eric Denning, and I am here to insert a Foley catheter aseptically or follow the aseptic procedure. Before I begin the procedure, I will start by verifying the physician's order. According to the physician's order, I am supposed to do this procedure at this time. So I will come to my patient, knock at the door, get in, introduce myself, and explain the procedure to him. Then I will identify the patient by verifying his wristband. And what is your name, sir? And your date of birth? And I have confirmed that this is the patient on which I have to carry on the procedure. So I will now start the process. I will provide for privacy and raise up the patient to a comfortable working position. Then I will expose the perineal area of the patient. I will do this while trying as much as possible to provide for his privacy. While my patient is still lying in recumbent position, dorsal recumbent position, I would ask him to put his legs apart. Before I carry on with the Foley catheter insertion, I would want to do perineal care on the patient. And I will also make sure that if the patient has foreskin on his penis, I will pull it back, clean the area, and make sure I replace it at the end of the procedure. That done, I will now proceed to set up my steroid field. Some hand hygiene. Then I open my steroid field, taking it away from me, myself. Holding this strip at the edges, I will place the shining side on the bed.
And then you always want to make sure you hang the drainage bag on the bed right below the bladder. And you'll
And now I will don my steroid gloves.
according to hospital policy, you'll attach it to the patient's inner thigh.
At this moment, I will want to extend my steroid field down to the bed. I'll prepare my equipment. However, making sure I maintain the steroid field. I wet the cotton bud with my Benadine. Having set my steroid field and prepared my equipment, I will now proceed to clean the penis with steroid fluid. So I can now grab the penis with my non-dominant hand and clean it with a cotton bud with a circular movement from the tip outward once. I will repeat this procedure 3 times at least. Now I can insert my catheter. But before inserting the catheter, I will want to lubricate the urethra of the penis. So I will take my jelly and inject it totally into the urethra. I will gently insert the catheter into the urethra of the penis. If I should encounter resistance, I will pull it back, try to turn it a little bit, and insert it again. If the resistance persists, I might stop the procedure and report to the doctor. I will now use my liquid to inflate the balloon. I will inject all of the 10 centiliters of water into the balloon. I will gently pull back on the catheter to be sure it is well secured inside. Following agency procedure, I might want to stick the catheter on the lap of the patient using a tape. Then I will want to clamp the catheter back on the non-movable part of the bed frame. So the catheter has been inserted. I will now clear off my surgical field, receptacle field. And discard of it. And I will make sure I return my client in a comfortable position. I can now take off my set gloves and dispose of them. I will assess the client for pain after the procedure, and then I will make sure I put the bed to the lowest position and place the core light beside the patient. I'll tell him to use the core light to get to me if there is anything he wants from me. At this point, I will document that the catheter was inserted aseptically. I'll document my initials and the time at which it was done. I will also document any findings, abnormal findings which I could have come across. And that will be the end of the procedure. So, do you have any questions? Thank you.